Yes. Hi, Dr. Henry. I know that you addressed this last week in a separate teleconference, but I'm hoping you can clarify what public health officials are seeing when it comes to COVID-19 transmission in South Asian communities. And if rates are higher, are there any factors driving that?
Yeah, so we have seen quite a lot of transmission in the South Asian community, particularly in the Fraser Valley and the Fraser Health region. But we know that that's where a lot of people of South Asian descent live, and we have a large and very vibrant, active community there. So yes, we have seen transmission in that community related to events, but we also recognize that many of the people in the South Asian community are essential workers. There are people who run our food processing plants, our trucking, healthcare workers. Many people in the South Asian community work in our healthcare settings. So it's not that we should be targeting a community. We know that there has been transmission in every community. And this virus does not tell the difference between where I come from, where I live, what my family's background is. So it has been a challenge for many, and we know that. And we know that there are many heroes in our South Asian community who have been working day and night, whether it's in healthcare, whether it's keeping food on our tables. So it is one of the areas that we've been working with leaders in the community to help make sure that they are doing everything they can to keep their families and communities safe, as we have with the Chinese Canadian community, with many other communities around the province. Do you want to address that?
First to repeat what Dr. Henry has said, that we've seen significant transmission, and you saw when the information by local health area was released on Thursday, the monthly information and the regular information by health service delivery areas, that the Fraser Health region is seeing significantly the highest number of cases, well over this 3-day period, over 1,300 cases, and that area is also an area with relatively high South Asian population. Is why, in terms of our delivery of public health messages starting in March and April, we've seen significant translation of guidance documents, of the survey we did, of advertising from the beginning in multiple language, including Punjabi and Hindi, and that will continue. We have a significant, for example, public information campaign now that's targeted, of course, in English, but also in Punjabi and in Hindi and in Farsi and in Chinese language, Chinese text, and so on. So we have to continue to make an effort there. It is a significant issue. I think what we've seen in our work with influencers in the community, really going back a number of months now, and we saw a rise in cases in Fraser Health, I think significant effort is being made in the community to deliver that message. I think we saw some impact on that, a significant impact in the celebration of Diwali this weekend, and I'm very appreciative to everyone who showed how to celebrate a major occasion such as Diwali in a safe way. But I think what's also true is that COVID-19 is everywhere in British Columbia and in all communities, that we have over 200 active cases in the Interior Health Authority. For example, we have more active cases right now in Vancouver Island than we've ever had. This is a time when COVID-19 in other jurisdictions in Canada, in the United States, and across the world is surging in many, many places, and British Columbia is one of those places. And so we have to, as public health, have to reach out and deliver that message, and we need communities to be leaders as well. And I'm very pleased to say that many, many people in the South Asian community have taken up that mantle in the last weeks and months, and we need them to continue to do so.
Do you have a follow-up, Briar?
Yes, I do. Just quickly, you talk about significant transmission, so I'm just wondering if that means that the transmission rate, I guess, or the number of people being infected is disproportionately higher than you would expect based on the population level. And if you could just answer Minister Dix the question about, what's being done to reach out to the communities in French, that would be great. Thanks.
Yeah, and we don't, as we've mentioned, we don't actually have rates by ethnicity of disease, so I can't answer that question with data. What we are seeing is that there are many families affected in the South Asian community, and many people live in large multi-generational families. And so, like other similar communities, when one person's infected, it can spread very quickly to many others in that family. And we know that there have been people affected across the community for sure.